This is your chapter 56 lecture, Oral and Maxillofacial Surgery out of your Modern Dental Assisting book. In this lecture, we are going to be talking about surgery and its specialty. So oral and maxillofacial surgery is the specialty of dentistry involving the diagnosis, surgical treatment of diseases, injuries, and effects of the hard and soft tissues of the head, neck, and facial region. Indications for maxillofacial surgery include extractions of decayed teeth that we cannot fix by restoring, surgical removal of impacted teeth, removal of teeth for orthodontic treatment, pre-prosthetic bone grafting, surgical implant procedures, orthodontic surgery that is used to straighten the jaw, removal of cysts and tumors, needle ablation, surgical repositioning to improve breathing, surgery of TMJ, treatment of fractures of the mandible or maxilla, reconstructive surgery, skin grafts, cleft lip or palate repairs, and saliva gland surgery. So members of the oral surgery team include the oral surgeon themselves. This is a dentist who's had an additional 4 to 6 years of postgraduate work in residency. And then the surgical assistant has some continuing education and certification after the completion of their general dental assistant program. The surgical setting is typically a private practice, so they are a specialist. They will have a surgical suite in addition to a regular dental treatment area. And we can do this in a hospital or outpatient surgical suite. For instruments, it's critical for the surgical assistant to have a working knowledge and understanding of surgical instruments. All are categorized as critical and must be sterilized after each use. We have our elevators, our root tip picks, forceps, surgical curettes, rongeurs, bone file. Some other instruments and accessories include the scalpel, hemostat, needle holders, surgical scissors, retractors, mouth props, chisel and mallet, and rotary instruments. As far as sterilizing goes, we do have asepsis. The chain of asepsis must not be broken. We should maintain a sterile field. The site where the surgical instruments and accessory items are placed during surgery. A surgical scrub is a type of hand wash that's used to lessen the chance of infection, and then proper gloving. So this is required for assistance in an invasive procedure. Our procedures include our forceps extraction. So this is the removal of the tooth that's fully erupted, multiple extractions and alveoplasty, removal of impacted teeth. This is going to be the teeth that are unerupted. Biopsy, so oral brush biopsy, incisional biopsy, excisional, and fine needle abrasion. And then placing sutures. Sutures are the stitches that are placed to control bleeding and promote healing. We can use either absorbable or non-absorbable depending on what the provider prefers. And then suture removal. Understanding and being able to explain post-operative care is important for the surgical assistant. We want to make sure that we understand controlling the bleeding, controlling of swelling, pain, and post-operative diet. So we want to be prepared for questions that our patients may have. With surgery, some complications can arise, so knowing these and being prepared to answer questions is important. Knowing about alveolitis, this is dry socket. This can occur when we're not caring for the extraction site. If the patient isn't following the home care instructions, we want to make sure that they have no negative suction in the oral cavity, including smoking, sneezing, coughing, spitting, drinking from a straw. And then we want to also warn women who are taking oral contraceptives. For the treatment of dry socket, we want to focus on reducing the symptoms, in particular the pain. So what we would do is have the patient come into our office or into our operating room and we're gonna flush out the socket. We would use a medicated dressing and then give pain medication and just really reiterate those, postoperative care instructions.